Euthanasia. Meaning. Euthanasia comes from the Greek words, eu, good, and Thanatosis, death, and it means, good death, gentle and easy death. This word has come to be used for mercy killing. The word, euthanasia, was first used in a medical context by Francis Bacon in the 17th century, to refer to an easy, painless, happy death, during which it was a physician's responsibility to alleviate the physical sufferings of the body. Definition. Euthanasia is the termination of a very sick person's life in order to relieve them of their suffering. Euthanasia, sometimes known as mercy killing, is the intentional ending of a patient's life by a physician, usually by lethal injection, overdose or withdrawal. It is the act or practice of ending a life of a person either by a lethal injection or suspension of medical treatment. Types of euthanasia. Active euthanasia. It is when death is brought by an act, for example taking a high dose of drugs to end a person's life by the use of drugs, either by oneself or by the aid of a physician. Passive euthanasia. When death is brought by an omission, e.g., when someone lets the person die, this can be done by withdrawing or withholding treatment. Withdrawing treatment, for example switching off a machine that keeps the person alive. Withholding treatment, for example not carrying out a surgery that will extend life of the patient for a short time. Voluntary euthanasia is committed with the willing or autonomous cooperation of the subject. This means that the subject is free from direct or indirect pressure from others. Non-voluntary euthanasia occurs when the patient is unconscious or unable to make a meaningful choice between living and dying, and an appropriate person takes that decision for him/her. This is usually called murder, but it is possible to imagine cases where the killing would count as a favor for the patient. Assisted suicide. This usually refers to cases where the persons who are going to die need help to kill themselves and ask for it. It may be something as simple as getting drugs for the person, and putting those drugs within their reach. Indirect euthanasia. This means providing treatments mainly to reduce pain that has a side effect of shortening the patient's life. Since the primary intent wasn't to kill, it is morally accepted by some people. Reasons for euthanasia. Patient has terminal illness that cannot be cured. Patient can't sleep without any treatment. Patient has unbearable pain. Patient has right to decide about self-treatment. People cannot be forced to stay alive. Pros and cons. Arguments for euthanasia. It provides a way to relieve extreme pain. It provides a way of relief when a person's quality of life is low. Frees up medical funds to help other people. Teleology. It is another case of freedom of choice, autonomy. Arguments against euthanasia. Euthanasia devalues human life. Euthanasia can become a means of healthcare cost containment. Physicians and other medical care people should not be involved in directly causing death. There is a slippery slope effect that has occurred where euthanasia has first been legalized for only the terminally ill and later laws are changed to allow it for other people or to be done non-voluntarily. History. It is believed that euthanasia started in ancient Greece and Rome around the 5th century BC. Some did this by abortions, and every now and then performed a mercy killing even though doctors were supposed to follow the Hippocratic oath, "I will give no deadly medicine to anyone if asked, nor suggest any such counsel." During the Middle Ages, euthanasia was pretty much out of the question. If one committed suicide, the law in Europe was for the body to be dragged through the streets or nailed to a barrel and left to drift downriver. During the 17th and 18th centuries, euthanasia was a topic of discussion. However, people continued to reject euthanasia and assisted suicide. 1478 to 1535, Sir Thomas More is often quoted as being the first prominent Christian to recommend euthanasia in his book Utopia, where the utopian priests encourage euthanasia when a patient was terminally ill and suffering pain. 1828, the first law against assisted killing, known as anti-euthanasia, was passed in New York. 1870, the use of morphine and analgesic medications for assisting quick and painless death was suggested. 1885, the American Medical Association strongly denied the use of analgesic for euthanasia. 1994, Netherlands, it is the first country where euthanasia has been allowed. 2001, the euthanasia law was adopted in Belgium. This law defines conditions for doctors to avoid penal punishment. 2008, U.S. state of Washington legalizes assisted suicide. Laws. In Europe, euthanasia is only legal in the Netherlands and Belgium, provided certain conditions are met. For example, the patient's request must be voluntary and well considered. The patient must be suffering unbearable physical or mental suffering. With no prospect of relief, the patient must be informed about their situation and prospects. At least one other, independent, doctor must be consulted. In Belgium, euthanasia is only allowed if the patient is an adult. However, in the Netherlands, euthanasia is allowed for children aged between 12 and 16 years of age, with the consent of their parents, guardians, and for individuals aged 16 years and over. Assisted suicide is legal in the Netherlands, Switzerland, and the state of Oregon in the US, but have certain conditions, e.g., the patient must be considered competent and aware of their situation. In Japan, only passive euthanasia is permitted for patients who have been in a coma for more than 3 months. While in Egypt, or in Islamic countries in general, the popular Egyptian scholar Sheikh recently issued a fatwa equating euthanasia with murder but allowing the withholding of treatment that is deemed useless. Religions. Those in favor of euthanasia argue that a civilized society should allow people to die in dignity and without pain. They add that as suicide is not a crime, euthanasia should not be a crime. Most religions disapprove of euthanasia for a number of reasons. God has forbidden it, that says, you must not kill. Human life is sacred. Human beings are made in God's image. God gives people life, so only God has the right to take it away. Religious views on euthanasia. Islam. Muslims are against euthanasia. They believe that all human life is sacred because it is given by Allah, and that Allah chooses how long each person will live. IMANA, the Islamic Medical Association of America, say that turning off life support for deemed to be in a persistent vegetative state is permissible. This is because they consider all mechanical life support procedures as temporary measures. Christianity. Christians are mostly against euthanasia. The arguments are usually based on the beliefs that life is given by God, and that human beings are made in God's image. Some churches also emphasize the importance of not interfering with the natural process of death. Life is a gift from God. Christianity requires us to respect every human being. Judaism. Jewish medical ethics have become divided over euthanasia and end-of-life treatment since the 1970s. Generally, Jewish thinkers oppose voluntary euthanasia, often vigorously, though there is some backing for voluntary passive euthanasia in limited circumstances. Shinto. In Japan, where the dominant religion is Shinto, 69% of the religious organizations agree with the act of voluntary passive euthanasia. In Shinto, the prolongation of life using artificial means is a disgraceful act against life. Buddhism. An important value of Buddhism teaching is compassion. Compassion is used by some Buddhists as a justification for euthanasia because the person suffering is relieved of pain. However, it is still immoral to embark on any course of action whose aim is to destroy human life, irrespective of the quality of the individual's motive. Recommendations for nurses. It is the shared responsibility of professional nursing organizations to speak for nurses collectively in shaping healthcare and to promulgate change for the improvement of health and healthcare. ANA 2015 AP 36. Therefore, the American Nurses Association supports recommendations that nurses remain objective when discussing end-of-life options with patients who are exploring medical aid in dying, have an ethical duty to be knowledgeable about this evolving issue, be aware of their personal values regarding medical aid in dying and how these values might affect the patient-nurse relationship, have the right to conscientiously object to being involved in the aid in dying process. Never, abandon or refuse to provide comfort and safety measures to the patient who has chosen medical aid in dying. Nurses who work in jurisdictions where medical aid in dying is legal have an obligation to inform their employers that they would predictably exercise a conscience-based objection so that appropriate assignments could be made. Protect the confidentiality of the patient who chooses medical aid in dying. Remain objective and protect the confidentiality of healthcare professionals who are present during the aid in dying process, as well as the confidentiality of those who choose not to be present. Be involved in end-of-life policy discussions and development on local, state, and national levels, including advocating for palliative and hospice care services. Furthermore, research is needed to better understand the phenomenon.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.